coverage options and who need help applying for health insurance coverage. And I believe our toll-free number is right here. We are here today to release some survey results regarding the views that Maine voters have on healthcare affordability, and to share with you a bill sponsored by Senate President Jackson to address one of the biggest cost drivers, facility fees, to our healthcare system. Comprehensive survey results show that Mainers remain concerned about the cost of healthcare, the cost of prescription drugs, and that many Maine households are in medical debt. Over 2/3 of Mainers believe that just one major medical event would cause a financial disaster, and half of them report actually losing sleep because of the concerns they have around the cost of healthcare. More than 1 in 3 Mainers have delayed going to a doctor when they were sick due to costs. 1 in 4 have cut pills in half, skipped doses of medication, or delayed or did not fill a prescription because they could not afford it. Nearly 1 in 3 Mainers were contacted by a collection agency over the past 2 years due to medical debt. 83% of those who were contacted reported that it was due to a hospital bill. I am grateful to the Senate President for being here today and for sponsoring LD 1795, an act to protect patients by prohibiting certain medical facility fees, which will be presented before the Joint Standing and Health Coverage, Insurance and Financial Services today at 1 p.m. Our helpline staff have heard from Maine people about the concerns they have around these facility fees. One woman was charged 2 facility fees, which went to a walk-in clinic because she injured her knee next year. Another son had passed out one evening. They contacted their pediatrician who could not fit them in to the schedule that day, and it was recommended that he go to a freestanding urgent care clinic. He received a bill for $1,900 that included a facility fee. That visit would have cost about $200 if he had just run there. These are just a couple of things, including another that we heard of from somebody who received a facility fee charge for a telehealth visit. Again, I'm so grateful to the Senate President for all he does to address the concerns that Mainers have regarding the cost of health care. And I invite them up today to talk a little bit about it. So, thank you.
Well, thank you, Ann, and thank you everyone. My name is Boy Jack. I serve as the president of the Maine Senate and proudly represent the people of Mercer County. And access to quality, affordable health care is an issue I care very deeply about. I know what it means for folks in my area, families all across the state. More importantly, I know what happens when folks can't get the care they need, outrageous prices for drugs, lack of health care, never ending medical bills. I know that because I deal with it personally myself and hear about it all the time from my colleagues and the Senate. Well, I'm happy to have Senator Chipman here, and honestly, the author, Dr. Evans, who you would work with so much in the past. The good news is, like Ann said, the Maine legislature has fought to make healthcare work better for people of the state. Codified basic consumer protection in Maine laws to protect folks with pre-existing conditions and ensure healthcare plans cover essential health benefits. We put strict limits on so-called junk insurance plans and rejected several attempts to weaken these laws. We've taken on Big Pharma with measures to improve access to life-saving medication, increase price transparency. We've even established the Office of Affordable Health Care and Prescription Drug Affordability to work on long-term, evidence-based solutions to these pervasive problems. And despite this progress, there's no question that we need to do more. I mean, sometimes, despite all the things that we've done, I still am frustrated that it's still so what it happens for so many people. We hear it from our constituents, live it every day. New data from Maine Consumers for Affordable Health Care only confirms that. Too many families are sitting around the table wondering what they're going to do with rising healthcare costs, rushing medical debt. And I share those concerns. As a matter of fact, I get those calls from collection agencies. It seems that you can't navigate the healthcare system without getting nickel and dime at every turn, even if you have health insurance and you've done your research. That's why I'm here today to introduce later legislation to address growing concerns around so-called facility fees. The public hearing for LD 1795 and act protect patients by prohibiting certain medical fees begins at 1, probably a little bit later, in the Health Coverage Insurance Financial Services Committee. And the measure would put strict limits on charging, billing, or collecting a facility fee in certain situations. I do think the bill is important in addressing one of the most insidious cost drivers in the delivery of healthcare. The cost patients may pay can be different depending on whether care is delivered in a hospital, clinic, or a physician's office. Regardless of the setting, it's often, almost always, difficult for the patients to know what they will have to pay for with the care that they receive. This bill will help reduce that sticker shock that many managers experience when seeking health care that they need, and that feeling that everyone is out to get you just because you're not feeling well and something unfortunate happens to you. So that's why we put the bill in. That's why I'm looking forward to having a hearing, and that's why I'm so thankful that Village will call the health care works on these issues with us. So thank you.
Thank you. Thank you so much. Your passion around this issue has helped a lot of mayors, as you mentioned. We have made progress. More mayors have health insurance than they did 5-10 years ago because of the efforts of the Maine legislature and the governor. But again, the survey data show that more needs to be done. I remain optimistic, given nearly all mayors, 89%, believe it is highly important that everyone in the state has access to comprehensive health insurance. And they support additional policy initiatives to reduce costs and improve access to health care coverage. And I believe that the Senate President's bill that he is introducing today will do that by addressing a really serious cost driver, facility fees. In your press package, you will see other data points that I think would be of interest to you, but in the interest of time, I'm going to stop right there. And thank you very much for joining us today and reporting on this important issue. Thank you. Oh, questions. Sorry. Yeah, sorry.
So yeah, I'm just curious, one of the things that hospitals will say about this topic is that if you stop facility fees, that, there'll be just charges somewhere else, increased charges somewhere else because it costs a lot of money to run a hospital and they need, this is one of the ways they can recoup the costs.
Yeah, thank you, Joe, for that question. And this is not an effort to be critical in our hospitals. We all need hospitals. We have loved ones who need hospitals. We need to do whatever we can to open their doors. However, I think there needs to be more transparency, and that's one of the things these bills do. It's really unknown to all of us how these facility fees are developed, first of all. And it's unfortunate when people pay a facility fee that they didn't have to pay because perhaps they were eligible for hospital free care, or because Medicare does not allow people get facility fees on the same day. There are a lot of issues around this that we don't understand, and the Senate President's bill will help us better understand. And again, we're not talking about eliminating all facility fee bills, but we want a better understanding of how they're developed, when they're being charged, and how does it affect bottom liners.
The other thing is you should know before you have the service. The other thing is you should know the facility fee before you have the service, so you can make an educated decision if you're going to go there, if you're going to go somewhere else. And that would be the most fair thing to do, tell people up front.
Any other questions?
We already have hospital transparency bills, right? Hospitals have to publish thousands and thousands of line costs for every insurance company carrier. How do you assess whether that's working given this? Every time we try to address surprise medical bills, government as a society, there's another wrinkle to it. And that seems to what's happening here. What are your thoughts about that?
Thank you for that question. I think transparency is really helpful in helping us all to try to understand what is attributing to rising costs, because let's face it, it is unsustainable. We are paying for healthcare, whether we have health coverage or not, is unsustainable. So something needs to be done to address rising healthcare costs, rising prescription drug costs. And without transparency, a better understanding of how something like facility fees are affecting our nonprofit hospitals, or how incredible profits are being received by pharmaceutical industries, we can talk about the fact that we need this money to keep the doors open and to create new drugs. But at the same time, incredible amount of money is being made by private corporations. So more transparency will help us understand where that money flows. It will hopefully help us make sure that consumers aren't left holding the bag and they can't afford the health care they need.
Do you find that insurers generally pay these facility fees or don't pay?
My understanding is that most insurance carriers are paying them, but they are also concerned about the fact that we don't know how these facilities, these are arrived at. And they're also concerned when they see somebody who walks across the hall to get another service being charged multiple facilities. So addressing the cost of facility fees could actually help us address rising health insurance costs as well.
I'm responsible for some projects, or to give kind of another example of that, you know, how your bill would work. So, you gave an example, someone goes into the hospital, one office gets charged a facility fee, another office gets charged another facility fee. So the projects would be able to explain like how you're.
So that's a great question. Thank you. Medicare, for example, will not pay for a facility fee that is charged for a service that's more than, I think it's something like 250 feet away from the main hospital setting. So if you go to a clinic in Portland that's 5 to 10 miles away from the hospital, you can currently be charged a facility fee for that service, most of the time unknowingly. This bill would say, if you're not on the hospital campus, you cannot be charged a facility fee. It also requires, as I mentioned earlier, some transparency and reporting about how facility fees are made up and what kind of revenue the hospitals are receiving as a result of this facility. Does that help?
Just one point of clarification. Sorry. So you mentioned that do you know in general of the insurance companies that do cover facility fees, does it generally still count towards your deductible? So if you have a high deductible, you're paying for it.
Yeah, and those are the calls that we're receiving from people who have coverage that are concerned about facility fees. The example that I gave, the $1,900 bill, most of that went to that person's deductible, and they are faced with paying almost $1,900 rather than perhaps $200 that they would have paid if they went to their efficiency.
Well, there's so many different variations of that. I mean, a lot of insurance companies, including the states, insurance, you go to the emergency room, it's a different deductible. You know, so you keep me away from it. I just was reading the email came in from someone was talking about, and they were told to go to the emergency room for something. And, they got a $2,700 facility fee for going to the emergency room. I mean, you know, that's outrageous. I mean, I think ours is, I don't know, 300 or something. No, I think the states are 300. In my time, it's gone from 25 to 100 to 300 okay, just to go to the emergency room. But get a $2,700 one. Well, that's like the variation of all. And to be honest, too, like the other question, I expect the insurance companies this year, that's fine, well, the goal is that's fine support. So it's a work trained well, I'm saying New York.
I'd like to introduce the Honorable Dr. Evans, who was a member of the House for a while. He has just recently joined the board of Institute for Rural Health Care, and thank you.
Thank you. I just want to thank President Jackson, this month in this bill. I think the issue surrounding this Bill 17 and 95 is going to provide some clarity. Most of the patients who are caught in this bind are confused because the rules are so different from one place to the next. The cost is different from one place to the next. They are confused and they end up getting these bills and end up paying high costs that they didn't anticipate. So I think that this bill will set some clarity because otherwise, if we continue down the road that we're going, we will continue to fail. And until Congress gets a spine to address this issue directly. The states can do as best they can to mitigate the circumstance.
Thank you. Can see why I'm so happy he's doing our work. That really shows that most private or the average deductible for private health insurance these days is over $4,000. So state employees is a little bit less than that, but if you can imagine what that means for people in terms of needing medical care and facing a facility being charged that they murder. Anything else? Thank you so much for joining us today.
How you doing?